Welcome to Prepared for Parenthood, the podcast for hopeful, expectant, and new parents with little ones up to age 5. I'm your host, Dr. Stephanie Duger, a psychotherapist, author, educator, parent coach, and married mother of 2. On this show, we'll discuss everything from the most up-to-date practicals of best supporting your young children, to thriving in relationship as a family, to more surprising topics around the psychology and development of babies from conception through age 5. So sit back, relax, and enjoy. I'm thrilled to have you here today. Welcome back to Prepared for Parenthood. Our guest today is Dr. Kailey Buller, a double board certified physician in emergency and family medicine who's helped bring hundreds of babies into the world and also raise 2 of her own. Dr. Buller combines her medical expertise with her lived experience to provide practical, evidence-based postpartum and newborn care for parents. And in her new book, Surviving Tiny Humans, The Messy Truth About Parenting and Your Guide to Baby's First Year, she brings the calm, practical advice of a doctor with the unfiltered honesty of a parent who's actually been there through the sleepless nights, mystery rashes, and the 3 a.m. Googling of, is this normal? When she's not soothing the emotional toll of a broken banana at home or stitching up ER patients, Dr. Buller teaches postpartum classes, busts parenting myths online, and fiercely believes that telling parents the truth with compassion and a bit of humor is the most helpful thing of all. So welcome, Dr. Buller. We're so happy to have you with us today.
Thank you so much. I am so very excited to be here. This podcast is perfect, by the way. It basically is what I do. So I'm just so grateful.
I know a lot of our listeners are new parents or expectant parents, and both of us have been there before as a new parent. It's really normal for new parents to worry a lot about their babies, right?
Absolutely.
And you're an ER doc. You must see a lot of new parents who come in maybe kind of panicked and like, oh my gosh, is this normal? Is my baby having an emergency? Could you share a little bit about how parents might know the difference between an actual emergency and when to come in and when they might want to wait it out and just speak to somebody on the phone?
Absolutely. I mean, this is so huge. There's no classes on common baby rashes, right? Or how to manage a baby who has a cold. It's so unfair to place an expectation on parents to know. So my first and always piece of advice is if you're worried, if your spidey senses are tingling, you come, right? See your doctor, see your midwife, see your doula, come to the emerge. We will never turn you away. And any doctor who's worth their salt is going to take into consideration the fact that you haven't been taught the same things that we have, obviously. And the other thing is if a doctor ever makes you feel judged for being somewhere when they sort of give you that vibe like you should have known better, then that's their bad, right? We sometimes take for granted what we've been drilled into us over and over and over again, and we forget that not everyone knows. That's my first piece of advice, right? Is if you're worried, you come. And there's nothing that I can say on a podcast or in 20, 30 minutes that's going to cover every scenario. And so that's always the first and biggest thing is if you're unsure, you should ask your doctor. The one sort of caveat to that, and I do see this, is when parents will bring in their completely asymptomatic healthy child. And I know that sounds crazy and there's no judgment here because it totally makes sense, right? They've got maybe a child at home who's sick and they're bringing them in anyway. And so they bring their 3-month-old because what's going to happen if they get sick? What am I going to do? How do I manage this at home? What should I look for? And those are all very reasonable questions. The problem is we're very unlikely to be able to give you any good answers. We don't know if your child's going to get sick or catch whatever your older child has. We don't know what it's going to look like. We don't know what symptoms they're going to have. And being in the emergency department with a 3-month-old, they're being exposed to germs, so more likely to get sick. So that's the only time that I would say, if you can, maybe don't bring your baby in. For every other scenario, that's what we're there for. But to make things a little bit easier, I did develop a list of things that were hopefully easy to remember that are true emergencies, and this is when you need to get to the ER. So there's 5 symptoms, 4 injuries, and 3 features of a fever that I would say you should bring your child in. So the 5 symptoms, some of them are very obvious. Seizures. If your baby's having a seizure, you come to the emerge. That's pretty straightforward. There are some that are a bit more nuanced. So lethargy. I don't mean your child has less energy than usual. I mean that they're sleeping way more than is typical, or to the point that it's hard to wake them. That's actually a pretty scary thing for us, especially in young babies. So if your child is so drowsy that they're not waking up easily, they need to be seen. And a change in behavior. So change in behavior is a bit difficult to quantify, especially for babies. That's probably going to look like inconsolable crying. So if your baby is crying inconsolably and you don't know why, I would say bring them in. And I'll talk a little bit more about that one specifically later because you see it all the time on doctor shows. But when you don't understand the behavior of your child, or if it's an older child and they're not behaving themselves, it's worth getting evaluated. The other 2 are a bit more easy to understand. One is dehydration. So in a young baby, that usually looks like not having had a wet diaper in 12 hours or more. If they have diarrhea and it's hard to tell, then it might be something like dry lips. But dehydration is a reason to bring a baby in. And then trouble breathing. Trouble breathing is the big one and probably the most common one that we see. So if they have a fever or not, it doesn't matter if they're having troubles breathing, they're working hard to breathe, they're breathing really fast, they're making funny noises when they breathe, they should be seen in the emergency room. It's not necessarily time for you to panic, but you should bring them into the emergency room. So those are the big 5 symptoms that no matter what else is going on, you should come to the emerge. And then there's 4 injuries. So the most obvious one is cuts and scrapes, lacerations. It's hard for parents to know what warrants stitches and what doesn't. They're not necessarily an emergency, but they need to be closed within 24 hours, and the emerge is the most likely place where that's going to happen. And if you aren't sure, if it's bigger than a grain of rice, we'll probably stitch it or glue it closed. So if it's as long, as wide, and as deep as a grain of rice, that one could probably use stitches. The other injuries would be burns that are big or blistering. So if you have your 9-month-old out in the sun and they get a tiny bit of a sunburn because you missed a spot with sunscreen, that's okay. But burns, especially face, hands, feet, and genitals, if it's big or blistering, they should be seen, even if it's small. The next injury would be a head injury. The easiest way to remember is if they fall from a height of greater than 3 feet, they should probably be seen no matter what. If they're completely well, we want to have them in the emergency department for some observation. If they're 6 months old and sitting on the floor and they fall over and hit their head on the floor and they're completely fine, that's probably not a head injury that needs to be seen, but something that's a fall from a surface, or they've just started motoring along and they hit their head on the corner of the wall, whatever the case may be, head injuries are worth being seen. And then the last one is something called a hair tourniquet. This is the medical drama's favorite issue to have. So when it comes to inconsolable crying, when you have a baby and they're crying and nobody knows why, and they bring them into the emerge and all the doctors are like, oh, we're taking this history and there's been no exposure and what's going on? And then you find out it's a hair tourniquet. It's very classic story on TV dramas. And what it is usually a strand of mom's hair that gets wrapped around a little finger or a little toe, sometimes even a baby's penis, and it starts to cut off circulation. This is incredibly painful, and that's why you usually see inconsolable crying. And it's actually technically a limb-threatening issue. If that isn't removed within a few hours, you can actually damage the finger or toe permanently.
Great information for new parents to be aware of, for sure.
Absolutely.
How much do you actually see new parents in with their new baby? What's the kind of percentage for you where you're at?
In my small emerge, on a typical shift, I would see at least 3 babies on a typical day out of the 20 or 30 patients that I see. So it's pretty common and it's understandable, especially because every issue with a baby is probably the first time you've ever seen it.
Yeah, and they're not speaking in words, right?
Right.
So they can't just tell you what's happening. Kind of a mystery, trying to figure out what's going on.
Absolutely. There were 3 features of fever that I wanted to just really quickly talk about that I want parents to bring their babies in for. One is if they have a fever and they're less than 30 days old. Nothing else matters. If they're less than 30 days old and they have a fever, they should be seen in the emerge. If they have a fever and you don't know why, no matter how old they are, You should also bring them in to be seen, and a fever that lasts more than 5 days. So those are the three things. If a baby has a fever, but they've got a very obvious cough and cold and they're 3 months old, you could probably keep that baby at home unless they start having troubles breathing. But those babies can typically stay home. But if it lasts longer than 5 days, they're under 30 days old, or you don't know why they have a fever, I would have them in the emerge.
So why under 30 days old? What is it about that time frame?
So babies under 30 days old, because they don't have a well-developed immune system, they're much more susceptible to the big, bad, scary bacterial infections like meningitis, for example. So meningitis, unfortunately, is much more common in babies under 30 days old. And often, actually, a lot of the things that I've talked about, like lethargy, change in behavior, fever, but you don't know why, those are all potential signs of meningitis. And that's why they're on the list.
Super helpful. So, Dr. Buller, you wrote this book that just came out. Amazing. Super helpful for expectant and new parents. And in your book, I noticed you shared some about your experience of navigating feeding your own two children when they were little. Would you be willing to share just your experience of that? And it's one of those questions that often comes up with new parents. It's feeding and sleeping. Those are the two big ones that often come up. And there can be so much pressure around how to do feeding, right? Like it should look a certain way, it should progress a certain way. And the truth is, it looks different for everybody. And I'm wondering if you would just be willing to share some of your own experience with that.
Absolutely. Yeah, I had every single support available to me and I had all the knowledge that I needed. And I tried and couldn't breastfeed either of my children for different reasons. With my first, I had no trouble with supply. And I mean, like spraying him all over the face whenever he even came close to my boobs, which I'm sure some women have or will experience at some point. But he wasn't gaining weight. So when we went at his 1 week checkup and his 2 week checkup, he still wasn't back to birth weight, which was a worrisome sign. So I got the advice, the wrong advice actually, but I got the advice to start pumping and bottle feeding to monitor how much he was getting and then also to top up with formula. And over time, with pumping not as effective as breastfeeding, I did lose my supply eventually. But it turned out that he actually had a cow's milk protein allergy. And I probably could have managed that much sooner. And I probably could have breastfed him, but I didn't know. And my doctor brain wasn't working at the time, obviously. My experience with my daughter was a much more difficult situation. I really wanted to breastfeed, having found out that I could have probably breastfed my son and just got the wrong advice. But I tried everything. I was feeding her while pumping on the other side. And then I would switch breasts and feed her on that breast and pump on that side. And then I would use a double electric pump afterwards to increase supply afterwards. And then I would power pump in the evening, which I didn't know was a thing until I started power pumping. Right. And I also had a feeding tube that I had borrowed from the hospital that I would siphon formula from the feeding tube and I would stick the feeding tube in while she was breastfeeding so that she was willing to stay on the breast because she was also getting some formula. And despite all of that, I just didn't have enough supply. So I tried for 6 weeks and I spent 6 to 7 hours every day feeding or pumping. And it was absolutely insane. It was insane. And I felt this enormous pressure to do it. And honestly, when I stopped pumping and breastfeeding both my children, it was so liberating. And I got back so much of myself and so much of my time that I wish I had done it sooner.
Speaking to the new parents out there, the expectant parents who may have the feeling that I need to breastfeed, this is what's going to happen. And obviously, sometimes nature has other plans for us. Life has other plans. What kind of advice might you give to those parents?
Yeah, I think the most important thing to keep in mind is that it's actually more common than not to struggle with breastfeeding. I think most women actually have some stumbling blocks along the way, but of the women in Canada and the US, it's something like 75% of women in the US will actually stop breastfeeding and start supplementing with formula or switch to formula before 6 months. And 55% of women in Canada will do so. So more women than not are not getting to that 6-month recommendation. So if you're struggling, you're not alone in that. That's actually more common than not. If anyone tells you that it's easy, they're lying to you. It is hard. But I think the most important thing is to look at breastfeeding and formula feeding more holistically. It's not just about the nutrients that your baby is getting. And keep in mind that formula is one of the most studied and highly regulated foods in the world. And it's a perfectly good option for your baby. It involves your partner in feedings too, and it can really limit stress. So when you take all of these factors into account, for some families, breastfeeding might not be the most optimal choice.
Removing some of the potential feelings of guilt or self-worth that might be attached to, I'm supposed to do it this way and this is the only way, can be really helpful for parents. So you're not going to permanently scar your child if things don't work out for you in that way. There are other ways. Your child is not going to starve, which is,
Absolutely.
I think, what a lot of people panic about. Like, my child's not going to have a healthy immune system. They're not going to have this and this and this. And 99% of things that go on can be repaired or supplemented or things like that. It doesn't say anything about your ability to provide for your child. And I
Absolutely.
think that tends to be a heavy burden that a lot of people carry.
Absolutely. I was going to ask if you ever heard or if you know the factors that make it more likely that a woman's going to have success with breastfeeding. I found this really interesting and shocking, actually. But the three most protective factors are whether or not you're married or have a supportive partner. And that makes some sense if you have the support. If you have more money, a higher income, you're more likely to be successful with breastfeeding. And if you have a higher education level, which I thought was so surprising. It has nothing to do with your physiology, your breast size, how healthy you were, how complicated your delivery was. Like, it really truly boils down to what socioeconomic bracket you fall in. And I think that that really tells us something about the supports that we have in our system. And it's more of a systemic issue than anything else. So whether or not you can be successful with breastfeeding is more about what we're doing than about what you're doing.
I guess in a lot of ways that makes sense, although I would think some of the physiological factors would be up in those top three, but I guess not. But it really speaks to how much new parents need support in all ways, right? And whether that's support to have family leave or support when you're at home or support with another child while you have a newborn, things like that. Those emotional factors play in for sure, as well as obviously people needing to get back to work if they're in a lower socioeconomic bracket or they have a job that demands that they return sooner than they feel able or ready. Often that can play a big part, right?
Absolutely.
So another hot topic, obviously, is sleep.
Yes.
Could you share a little bit about your advice for parents around navigating sleep with a newborn and as your child gets a little bit older, and maybe some of the myth busting that can accompany the sleep issue?
Yeah. Yes. Oh, I'm sure you know better than anyone. There's so much advice. There are so many opinions out there, and they range from harmful to helpful, right? There's a huge spectrum of information out there. And my biggest piece of advice, honestly, is I think every parent should have a healthy dose of skepticism when it comes to any of the advice that they hear, right? You have to understand that anyone who's giving advice, even if it's a professional, even if it's someone that you should trust, it comes with subcontext. What are their values? What do their family dynamics look like? What is their understanding of the issue? Even if I were to give advice today and it doesn't sit right with you or it just is contradictory to something that you thought you knew, I would encourage you to dig a little deeper. Don't take anything at face value, because sleep in particular has so many other people's intrinsic subcontext in it, right? This is what I value. This is what I think is important. These are the factors that I think should outweigh all the other factors. So that's sort of where I think we should start, because there are very few times in parenting where something is universally true for every family. So advice like you should never sleep train a baby under 1 year old, I hear that a lot. That might be true for some people, but it might not for others. And I think the easiest place to start is when we talk about sleep training, what are we talking about? How are we defining that? Do we mean total extinction, which is where you put your baby to bed and then you don't go back the whole night, because that's one method of sleep training. And it might actually be appropriate for an older child. But yeah, I agree. If you're doing that, it's not appropriate until you know your baby can actually go that long without a feed. And that's going to be at the earliest around 9 months. If we're using sleep training as any cried out method, where you're teaching your baby to soothe themselves, then again, yes, I think it's probably appropriate to wait until they're developmentally able to soothe themselves, which starts around 4 months. So having an understanding of that is going to make that advice make more sense. But if we talk about sleep training in the context of establishing healthy sleep fundamentals and helping your baby learn how to sleep independently, that can start from day one. There are sleep training methods that are absolutely appropriate and actually probably better between day 1 and 6 weeks, like the pick up, put down method. Have you heard of that one? Yep. Okay, so it's exactly what it sounds like. It's pick up, put down. So you put your baby down. If they start to fuss, you go in, you pick them up, you soothe them. And when they start to get drowsy, well, their eyes are closing, but before they're fully asleep, you put them back down and let them sort of fall the rest of the way to sleep on their own. And you can do that as many times as needed until your baby falls asleep. And that's just giving them time to practice getting the rest of the way to sleep without relying on you 100%. But it's completely developmentally appropriate because you are responding to your baby's needs. You're responding to their cries. You are soothing them. You're just doing that small little piece to help them learn to fall asleep. And that doesn't mean that you can't contact nap or rock them to sleep any other time that you want, but maybe occasionally you try and put them down and let them sleep on their own.
So as with feeding, sleeping takes a lot of different forms and has many different stages and looks different even within your own children, the way that they learn to sleep. And a lot of it's biological, a lot of it's learning how to do something new. And so it can be a real struggle. Some people I've heard everything is really smooth, but that's rare.
It is rare. Yeah.
Most parents I speak to, that's part of the reason they might be coming in and haven't slept in. I can't even tell you how long. And how do I navigate this? And we know that sleep for parents is so critical, right? It's so critical to your well-being in all areas. So sometimes you have to try things that you thought maybe you weren't going to try. Sometimes that's the way that is going to be helpful. So again, no judgment around it, just keeping everybody's well-being at the top of the list, I think is so critical.
And I think that's a really important point that you just raised is when you go into parenting, be prepared to adapt. Be prepared to try something if something isn't working. Because I know a lot of parents go in and they say, I'm not going to be the parent who co-sleeps. I was that mom. I'm not going to bring my baby into the bed with me because I know it's unsafe. And it's so easy to say that. Co-sleeping increases the risk of SIDS. SIDS is scary. It's bad. Nobody wants that. So don't bring the baby to bed. But then what winds up happening is parents will fall asleep in the nursing chair or on the couch because they're trying to avoid the bed. And that's more dangerous. And as you mentioned, the sleep deprivation can be really harmful. So being flexible, I think, and understanding that your baby may not follow the ideals that you were hoping for, that the reality might be a little bit different. I think that's important.
Anything else from your book that kind of jumps out that you feel like would be especially helpful for new parents?
Really good question. If it's okay, I'll tell you a little bit about the book because I think overall, the book is not so much medical advice. And I think people expect that it would be a super tedious, boring medical book because it's written by a super tedious, boring medical doctor. But that's not what it is. I remember having these babies, and I'm probably one of the most qualified people in the world to be a mom. I mean, I'm a family physician, so routine childhood development, common illnesses, routine care, vaccines. I've got all of that. I deliver babies. I care for newborns in the hospital, and I'm an emerge doc. Like I have most of the training that you could possibly have to parent a child. And I had no idea what I was doing. Do you know how many questions I had? I was like, what car seat? What does baby led weaning? Why am I supposed to do that over purees? There were so many questions. Is my baby supposed to breastfeed literally 24/7 or is that not normal? You don't know. You really don't know until you're in it. And so having the medical background, but also having the lived experience, I wrote down everything that nobody tells you, from how often they should be breastfeeding, what is in the range of normal, how to manage formula if you are going to be supplementing with formula, what you need to know about formula, because no one tells you that. And then you're going into the store and there's 27 brands of formula and you're going, which one do I choose? I have a whole section on diapers, what to expect, what is normal about poop. Is green poop normal, brown poop normal, yellow poop normal? They're all normal, by the way. But I get a lot of those questions in the Emerge too, about rashes, about poop, about constipation. And then what equipment do I need? What kind of high chair should I buy? What kind of car seat do I need? What kind of stroller should I get? Should I be using a Jolly Jumper or not? Should I be using soothers or not? Did you know that soothers are controversial? I didn't know that.
Pacifiers?
Yes.
Yeah.
I thought that was just a thing that babies used sometimes. But apparently there are camps that say you should not use a soother.
Mm.
And there are some that say you should. And it turns out that using a soother can be protective. It reduces SIDS risk, but it also increases the risk of ear infections. I didn't know that. So again, every decision that you make in parenting, there's going to be pros and cons. Whether or not you use a soother, there's going to be pros and cons. So the book really outlines all of that. But the most valuable chapter, I suspect, is the medical chapter. I go through a really easy color-coded triage system. So green, yellow, red, and black. Green, you keep them home. No worries, you don't have to worry about anything. Yellow, keep them home, monitor them. Red, urgent appointment. Black, straight to the Emerge. And I talk about every common childhood illness, every common rash that you might see. I have pictures of the rashes. This is what baby acne looks like. This is what erythema toxicum looks like. This is what you might see and what you do at home and how do you manage cradle cap at home. So all of that is in there because those are the questions that you're going to have at 2 a.m. that you probably don't want to be doom scrolling or going to the Emerge for.
Again, super helpful. I would have loved to have had something just to stick on the wall, and this one's in the green. I'm good here. Yeah. We have been speaking today with Dr. Kailey Buller. She is a double board certified emergency and family medicine doctor, and she's also the author of a new book called Surviving Tiny Humans: The Messy Truth Around Parenting and Your Guide to Baby's First Year. Super happy to have you on today, Dr. Buller. Can you share how people can get in touch with you or find out more about you, your book, your work?
Absolutely. If you just remember Vitals with Dr. Buller, that's my website and my social media handle. You can follow me on Instagram or on TikTok. And I post on there pretty regularly some of the advice that I have. But honestly, if you want the book, that's the best way to go. Best bang for your buck. I talk about everything. And you can find that at any major retailer. Probably most easy to get it on Amazon.
Thank you so much for being here today. It's been a real pleasure to have you.
Thank you so much. I appreciate it.
Take care.
Thanks.
Thank you so much for listening to the Prepared for Parenthood podcast today. I hope you found this episode educational, informational, and conversational, and that you'll join me again for another episode soon. If you enjoyed listening to today's podcast, I'd very much appreciate if you would rate, review, and subscribe. If you're interested in more information related to today's podcast or are looking for parent coaching or courses, you can find my information in the show notes or online at preparedforparenthood.com.